isyong pangkalusugan. Ang atin naman pong tatalakayin kasama si Dr. Regine Solante, isang infectious diseases expert. Doc, muli po magandang umaga sa inyo. Welcome back po sa Laging Handa.
Hi, good morning.
Yes, Doc, pinaplano po ngayon ng DOH na i-reconstitute ang member agencies ng Interagency Task Force o IATF. Ano po ba ang masasabi niyo patungkol dito?
Yes, I fully support that reconstitution or what we call this reformulation of the membership. I think the present management or administration feel the need to streamline it so that there will be faster and more concrete decision. No? And I think the formulation here is also part that members should also be the ones that are really at stake in terms of decision on how we can protect the population, how we can move forward in terms of increasing the mobility, increasing economic activity, and at the same time, balance also the health of the Filipino people. So I fully agree with that.
Well, pero Doc, ano po ang sa tingin ninyo ang dapat pagtuunan ng pansin ng IATF once na ma-reconstitute na po ito?
Now that we have a different situation, before kasi we have these variants of concern, mataas ang mga kaso at mataas ang na-hospital. No? But the current prevailing situation now is that yes, we have the variants of concern, still highly transmissible, but it's not occupying a lot of our hospital beds. No? So that means that there is an area there that this current infection is not as disruptive as that with the previous variant of concern. So sana matutukan ng pansin ng bagong IATF on how we can enhance our mobility, how we can enhance our life in terms of looking at it and living with the virus without that fear that when we have this virus, we will be having severe infection. And that includes the efficiency of how we can manage to increase the booster population, no? And the balancing also that we continue to do testing, compliance with the LGU on providing vaccines, and at the same time contact tracing and all other aspect of the pandemic that we can move forward and at the same time without much disruption to our life.
Okay, Doc, meron na naman po tayong bagong subvariant under monitoring. Ito po yung BA.2.75. Ito po bang subvariant na ito ay mas nakakahawa o mas severe ang sintomas kung ikukumpara sa iba pang mga subvariant?
Well, it's too early to tell the characteristic and the behavior of this new Omicron subvariant of BA.2.75. But there are mutations that they found that most likely it can have a higher rate of transmission, no? Just like what we have now with BA.5. And there is also a possibility that it can also affect our vaccines. But if you look at the genetic tree of the Omicron variant, as they evolve, there is always that increased transmissibility and the ability to evade the vaccines, no? The protection that we have with vaccines. So we will wait for more data if the other area there, if it can really cause severe disease. No? Dahil importante din yan sa atin. No? Kasi when we look at variants, those are the important implications. Kung mataas pa ang hawaan, mataas ba yung risk na pwede kang magka-infection despite na bakunahan ka na, or pwede kang mas malala ang presentation mo. So it's too early. This variant of concern has been in like 10 or 12 countries, including India. And I cannot see that it will not happen here to us, no? Or it cannot enter here. There's a possibility. It's only a matter of when it will enter here, and that we have to also prepare, just like what we're preparing now and we're doing with BA.5.
Okay, eto po, nabanggit niyo na yung BA.5. Mas dominant o mas maraming cases ng BA.5 ang nadidetect ngayon kumpara sa ibang Omicron subvariant. Posible po ba na itong BA.5 ang rason kung bakit tumataas po ng halos 2,000 na ang COVID-19 cases natin kada araw?
Yes, I fully agree with that, no? Because kung titingnan yung number of samples na na-sequence natin, napaka-konti lang. But in that low number of amount, nakikita mo majority na doon is BA5. So that's already a representation of what is going on in the community, what is going on in the population. So the fact na mas mataas na ang kaso ngayon, maraming nahawaan, and in fact, no, ang nakikita namin dito, based on the ground, kadalasan sa mga na-infection, unang-una, ang target are the unvaccinated kasi wala ka talagang protection. Pangalawa, yung may mga bakuna na pero hindi pa nagpa-booster. And then pangatlo, yung may mga booster na, especially the vulnerable population, but because of being vulnerable, 60 years old and above, 50 years old and above, with comorbidities, nataas pa rin ang hawaan. And in fact, these are the people that we want to protect because these are also the people that we are seeing in some hospitals na nag-severe despite na nabakunahan na. No? And that's why in the vulnerable population, we have to focus on this one, how to maximize the protection. And that is really encouraging them to get the second booster and continue with the health protocol. Dahil sa age nila at sa immunocompromised condition, talagang mababa ang protection nila. And they can get this BA5 and can be getting the severe form of the BA5.
Okay, Doc, sinabi po ng DOH na no need to tighten the border controls sa kabila ng banta ng bagong Omicron subvariant. Sang-ayon po ba kayo dito?
Well, I agree on that, no? Kasi alam naman natin, no? We have had before the BA2, the BA1, and then other subvariants na hindi naman tayo nagta-tighten ng border control. What is important now is to really monitor the cases. Importante ngayon na ma-monitor natin kung who are those getting the severe infection. That's one. We will continue to encourage everyone to get tested. And once they are positive, coordinate with the local health centers, no? Sa mga doktor nila. If they're going to get an antiviral treatment or just to be isolated, and ang napaka-importante pa rin is that we always have to imply the importance of health protocol. Ang pagsuot ng face mask, ang tamang pagsuot, at kung nandun ka sa pagtrabaho, exposed ka everyday, always make sure that you're wearing your face mask and hopefully lahat ng mga exposed, especially mga essential workers, get already their second booster.
Okay, Doc, iminungkahi niyo po na gawing mandatory ang pagtuturok ng booster shots pero hindi po sang-ayon dito ang ating pamahalaan. Ano-ano po ba ang magiging advantage o outcome kung gagawing mandatory ang pagkuha ng booster shot?
Okay, nasabi natin yun before dahil napakabagal nung pagtanggap ng booster. And alam naman natin, no? Let's make this, this is the important message here. The current Omicron variant, the BA5, is totally different from that of the previous variants of concern. And definitely, no, yung bakuna natin na natanggap, yung primary vaccine series natin, doesn't work anymore. So napakataas ng hawaan, napakataas ng pwede tayo magkakasakit. No? And that's why the importance of getting the booster doses, because when you give the booster doses, you maintain the immunity na hindi ka magkasakit, particularly hindi ka magka-severe infection. Okay? Now, making it mandatory will improve the uptake. No? Yun yung pagsabi ko noon. But I think the DOH have some options that it cannot be mandatory. There are other options na pwede nating palaguin na magpa-booster. Then I fully agree with that as long as dapat konkreto yun, ano yung mga options. And we need to act fast, no? Because the BA variant 5, hindi pa natin alam kung hanggang kailan to matatapos. And I know it will not just end in a week's time because maraming pang vulnerable population na pwedeng matamaan dito. And we also have the specter that there's another variant of concern, the BA2.75, na hindi natin alam kung gaano to. So talagang wala pa tayo doon sa tinatawag natin na new normal, no? Because all these cases, still important to observe all the protocol that we have had, especially now na tumataas ang mga kaso.
Okay, sa ibang usapin, Doc, meron ding isa pang virus na highly transmissible. Pinangangambahan po ngayon itong Marburg virus. ano po ba itong Marburg virus? May posibilidad po ba na makapasok din ito sa ating bansa?
Yes, Marburg virus is one of the viruses na kapamilya lang, no, ni Ebola virus. And remember when we had that Ebola scare in 2016, dahil maraming bansa nag-report nito, we have that preparedness also against Ebola. So sa akin, hindi yan remote na pwede tayong pasukan dito. And just like any other emerging and re-emerging infectious diseases, we always try to prepare for that. Na hindi makapasok, or kung makapasok man, dapat preparado ang mga healthcare facilities natin. And I think with our experience in the preparation of the Ebola in 2016, magkapareho lang ang mga recommendation and policy on how to handle it, how to contain it, and how to prevent it.
Okay, Doc, ang inyo pong mensahe o paalala na labang sa ating mga kababayan.
Yes, salamat. No? So again, as an infectious disease expert, we continue to give you important information on prevention. At ngayon, hindi lang COVID ang hinaharap natin. Meron din ang dengue, meron din ang influenza or flu or other infectious diseases. Kailangan mag-ingat at we have to monitor ourselves, and at the same time, always follow the health protocol and get boosted with the COVID-19 vaccines, including other vaccines, no, na kinakailangan na to prevent other infectious diseases.
Okay, maraming salamat po sa lahat ng impormasyon na ibinahagi niyo sa amin ngayong umaga. Nakaparin po natin si Dr. Rogine Solante, isang infectious diseases expert. Stay safe po, Doc.
Thank you.